It's so ironic to me that we just assume we know what patients want and need. And yes, we are all patients, but we are not the same patient. And for decades, we have just assumed, I know what all patients want. And you're of this age, or you're this race or ethnicity or this income level. So I can make some assumptions. But those assumptions are being challenged and changed all the time.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show, this is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about whole body scans. How do they work? Who are the main players? And what's their true value in a consumer's constellation of care? I'll talk about that. Then I catch up with Adam Cherrington to talk about how we can keep the voice of the patient a priority, where patient experience and consumer centricity overlap, and what we're both seeing in these areas that give us hope and frustration. I'm Jared Johnson. Let's get it. Flava of the week. Let's take a deeper look at one of the fastest growing areas of consumer health that's also often regarded as a luxury. I'm talking about whole body preventive health screenings. They're offered by companies like Prenuvo, Ezra, and Health. Prenuvo and Ezra focus on MRI-based scans designed to detect potential cancers, cardiovascular issues, and other abnormalities before symptoms appear. Health, on the other hand, takes a broader approach by combining advanced body scanning with blood testing, cardiovascular assessments, skin cancer screenings, and AI-driven analysis. Depending on the provider and scope of testing, these services typically cost anywhere from a few $100s to more than $2,500 and are generally paid out of pocket. These companies are attracting growing consumer interest, particularly among health-conscious individuals willing to invest in more proactive insights into their health. The trend extends beyond imaging alone and reflects a larger shift toward continuous health monitoring and prevention. Companies like Swaay.Health, who right now are offering a partnership with Ezra to offer full body scans for $8.99, along with wearable platforms like Aura and Whoop, are helping consumers track biomarkers, sleep, recovery, and other health metrics on an ongoing basis. What's the consumer lens? I like the balanced approach taken by Dr. Gordon Chen, who's a frequent guest on this show, by the way. In his newsletter on June 16th, he wrote that while the technology holds promise for detecting disease earlier, there are trade-offs. He highlighted the significant risk of incidental findings, which are unexpected abnormalities that may never cause harm, but often lead to additional testing, procedures, cost, and anxiety. He also noted that no studies have yet demonstrated that widespread whole-body MRI screening improves lifespan or overall mortality. I think that's a well-educated point of view, and I'll add that this seems to be another signal of the overall interest in prevention, regardless of the price point or technologies involved. And that's significant because these will eventually get commoditized and become more accessible by a greater number of consumers, not just the celebrities who are endorsing them now. And once these offerings have scaled, that's the point where we'll better understand their true value in the consumer's health ecosystem. Let's consider what other signals are revealed by the growing demand for whole-body scans and look beyond the celebrity endorsements to see how they might play a part in choices about longevity and wellness. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, let's get into the flow. I've had Adam Cherrington on the show. It was a few years ago, and then his role has just evolved, and all that to be said, I'm thrilled to have him back. You might be seeing Adam quite a bit on this show moving forward. I think we have a lot to talk about. And without further ado, let's get you started. Welcome, Adam, to the Healthcare Wrap.
Hey, Jared. So good to be with you. Thanks.
Again, I think a lot of people are very familiar with you in previous roles you've had. I'm just going to say it. I feel like you've had a strong influence on the industry. And part of that is what you consider to be important in healthcare. So I don't want to take any more of your thunder there, but let's start with kind of giving you a chance to introduce yourself. How do you describe yourself? Because then I want to actually ask you a question about it.
Yeah, well, that's kind of you to say. You know, it's such a wonderful industry, right? At the end of the day, Healthcare is so important. We have to have that collaboration. And I think within the consumer engagement, the patient experience community, even more so, people are striving to learn from each other and help. One way I'd describe myself is the megaphone for the voice of the patient. We need to listen more. We need to include them in all stages of healthcare and healthcare IT. You think about a patient, how they're most vulnerable when they come into a healthcare experience. And I believe you have to have a servant heart to be in healthcare anyway. It's such a challenging industry, but it means so much. And patients need to be included. And it's so ironic to me that we just assume we know what patients want and need. And yes, we are all patients, but we are not the same patient. And for decades, we have just assumed, I know what all patients want. And you're of this age, or you're this race or ethnicity or this income level. So I can make some assumptions. But those assumptions are being challenged and changed all the time. And some of the most fun projects I've done in my career is when we ask the patient and get their perspective. And then we can use that to challenge those assumptions. Like, one that's still prevalent today. Older patients won't use technology when in fact they're some of the most they adopt technology at a higher rate than others in many cases. And the list goes on and on. And so my excitement is to make sure that we are including patients both on adoption of technology, creation of technology, in the journeys that we help create, the processes, and it's not hard to find health systems that think that way. Most of us want to be patient-centric. The PFACs are prominent in the industry, so that's a great sign. But there's so much more we can do, and that's where I've really found my passion and what I hope I can help with.
Thank you for that, Adam. I've noticed on your LinkedIn profile, you even refer to yourself as patient champion. That's one of the ways that you describe yourself. Is that what a patient champion means to you, of being one, starting with including their voice in more places?
Boy, I hope so. I refer to myself as that because I always want to bring them to the table and include their perspectives. And it's so challenging to be a patient. You think about just something as simple as finding out what am I supposed to pay? I'm a willing patient. I'm trying to engage. 2 days ago, Jared, I was trying to pay a bill and I had to talk to somebody live. I reached out. It took them 10 minutes just to know who I was. And then they transferred me to someone else. It took another 10 minutes for them to find out who I was. And I'm thinking, just treat me like a friend. Treat me like you know me, and treat me like we've done business together, or you've seen inside me literally. And, communication. Just make it simple to communicate. Make it easy to be a friend. So I hope I am a patient champion, and I invite others to be that as well. But that is something I gravitate towards, just highlighting their absence at the table, if that's the case, or celebrating when they are included. Working on a project with a vendor that is wanting to develop a new product, and to their credit, they want to bring in the voice of the patient before they even design it. And too often we come to them at the last yard, the last mile, if you will, and say, "Hey, we made this thing for you. Will you give us a thumbs up and tell us you love it?" And it's like, well, that's too late. We've got to include them earlier. So, there's very complicated things in the industry that will still take years to fix. Just getting the data from one place to another, that is complicated. It's challenging. There's security issues. There's privacy issues. But there's so many things just in principle that we can easily change. Just raise your hand and say, "Hey, we're doing this thing to the patient, but have we asked them? Have we brought in somebody? We have a new mothers program. Do we have any mothers here to guide this?" Something as simple as that. And so I hope we're always trying to think that way.
I hope so too. I think that's kind of like the foundation of our discussion today, and just the foundation of the direction and the movement that we hope we continue to see. I'm not joking at the beginning of the episode where I say this is more than a show, it's a movement, because there are some positive changes we are seeing and want to keep seeing in the industry. So yeah, that takes more than just talk. There's a lot of talk. So we want to do more than that. One conversation that you and I have had recently is an interesting one, because I notice I fall prey to this sometimes, where I get caught up in the ways that we describe patient experience versus consumer experience. I've talked about it for years on this show, and there's some practical ways to think about it. I feel like you and I kind of came up with a Venn diagram, if you will, of a lot of things that I think are in common, almost everything, truthfully, almost everything in the patient experience that is also considered part of consumer centered health. When we're talking about the types of things that we want to see with the improvement of how things are built, designed, operated, how they're marketed, even, those are things that you're right, can't just be left till the very end of a process as a check mark, or those things just don't work out. We could probably spend a whole episode or maybe even a whole series of episodes talking about why kind of the headlines, the hot takes on why certain products and services and companies in healthcare have failed versus why they actually failed. And I'm convinced more of them have failed because they didn't actually ask a patient or consumer, or in some cases, even a clinician, like the users of things, if it would work, like their input on it and how useful it would be. And that is just a different conversation than I see and hear happening a lot. What are your thoughts on that just in general? Like, as you and I were kind of putting that together of like the intersection of what we generally consider patient experience versus consumer experience or just consumer centered.
You know, what I like about it, it helps us remember that there are differences there. And I like how you think of this, Jared, that the nomenclature is not as important as just the mission and the movement that we want to see. But I like that it helps you think about the different jobs to be done for a consumer, for a patient. That's what it's about
Absolutely.
in 2026. It's, I'm hearing just the most interesting things from even vendors saying, hey, the tech is not what differentiates things anymore. The tech is becoming a commodity, which out of the mouth of a vendor sounds so crazy to hear. But think about those jobs to be done for a patient. Help me find care. Help me access care. I feel like I'm always a consumer, but I'm not always a patient. But I want you to help me have a consumer-friendly experience. And I think healthcare on the outside tries to bring people in and say, hey, it's about your choice and we will work with you. And here's choices to schedule or to communicate or to engage or find information. And so what I like about this diagram, it really helps you understand, hey, let's make sure that patients can find and access care, that the apps and tools they need are simple to use. And it's because everywhere outside of healthcare, we are deep into the consumer world. You can purchase things, you can get information without lifting a finger. And then we come into healthcare and it's like, oh, you need to fax something. You need to call me. You need to do these things that just don't make sense. And so, really, really like this approach to think about what are the jobs to be done for consumers, for patients, and where do they align in the middle?
Yeah. And people who are watching this on YouTube can see this now. This is probably the most simplistic version. There are probably 100 different parts of the patient experience I'm not even listing here. So I want to give that caveat, right? Like this was meant to focus on some of the, I feel like, emerging areas that are being framed from both sides, like that are being referred to quite often as part of a patient experience or a consumer experience. The way we've differentiated a lot on this show and in the healthcare app community is inclusive of what happens with the patient experience. And in addition to that, all the things that happen maybe when you're not actively engaging as a patient, which, for a majority of people, probably is not every single day that you're engaging with the healthcare system. For some, it is. So it's meant to be inclusive of and just recognize that even if as we work this direction to make things easier and more convenient and more doable for those who are actively engaging as a patient, all the things that lead us to engage more in our health are just as important. So those are things like preventive health and proactive health and things that there's just always been this wall. What I've seen in the industry, oh, that's preventive. Oh, that's wellness. That's health versus health care. I have really been encouraged by whether it's the tech vendors who are driving it or just new capabilities or just new awareness on the health system side. I can point to advocates on every side of the industry who are pushing through that wall, kind of breaking that wall down and saying, we're all still talking about people seeking care in one way or another, or choosing not to because the experience wasn't right for them. They didn't feel seen. They weren't able to make it work. They didn't feel like they could afford it. So all those things come into play on both sides of this diagram. Where it kind of focuses in the middle are a lot of the areas where I think I'd say from the health tech and health IT side, I see more focus. So that's a caveat here too. It's important to recognize like the clinical community has to be part of this too. So I didn't intentionally leave anything out or any side of the industry out of this diagram. It was an attempt to just to say, look, like we're talking about the same things, right? Because when you talk about what was traditionally known as the digital front door, and now what is it now? Is it like access plus? Like is it just access? Is it scheduling? Is it capacity? I think there's a lot of questions about what are we referring to at the digital front door anymore. I'm hearing digital lobby. I'm hearing digital front porch. I'm hearing like all these things, and so there's an evolution there. We can say that, but I would put that and access probably similarly together. Clearly, that's the start of a scheduling journey in a lot of ways. So that's easily part of both, the patient side and the consumer side. You have the CMS Health Tech ecosystem, which has its next big milestone event coming up in early July, marking basically 1 year since it was announced. So there's a lot of effort going in. There are vendors talking to each other. There are demos happening. There are a lot of flows of data that have never been possible before that are being shown as proof of concept. Then you have consumer apps and what I'm increasingly hearing referred to as health intelligence platforms. That is literally everyone from Aura and Whoop and other wearables referring to what they can connect to now as a health intelligence platform, to ChatGPT and Claude and Perplexity and all the LLMs and generative AI, apps and chatbots that are saying now we can connect to your EHR. Now that's a health intelligence platform. So yeah, like there are just a lot of players in here. We put rural health on here because of clearly the rural health transformation program. There's more dollars going in, and then there are lots of new types of primary care that really get me excited. Some are membership based, some are not, but almost all have a digital component that just make answering the basic questions a lot easier for you and feeling like you have a relationship with a provider of some kind, making that easier. That's everything from advanced primary care, direct primary care. There are more digital men's health and women's health specific offerings out there now. They're being marketed direct to consumer. So all of those are kind of out there. And then I'd say one of the biggest opportunities here that is on the diagram is patient advocacy on the patient experience side. I believe that's an area where I really respect your point of view here. Like, what is your thought, or what are you seeing and hearing when it comes to opportunities to grow patient advocacy?
Well, you think, and by the way, I agree with what you just shared with us, because there needs to be energy focused on these efforts and jobs to be done, not get tripped up on, hey, what do you call it versus what do I call it? Let's just focus on the bigger picture. Regarding patient advocacy, there's so much passion, and I would even add the word resources for some of these things, that you think about the possible synergy that can happen when we don't get tripped up on nomenclature and different jobs to be done. But boy, if we can focus some of those efforts and combine interest, I think that will advance the cause of making healthcare easier. Many advocacy groups, many that are passionate about including the caregiver. You think about where healing happens. It's not just the patient, but it's their community around them. And the clinician, the staff, they are part of that, but there's so many others that are part of that. Jared, I may have told you my wife's healthcare story. Years ago, she was diagnosed with stage 1 breast cancer. And boy, it just rocked our world. That was all we thought about every day. How do we help her? What does she need? And what does our family need as a result of her journey? And we had family and neighbors and people in our church and so many that had to contribute to that effort, in addition to good clinicians that cared. But even the navigation of our own journey was so complex and so challenging. I would just always remind us, part of the voice of the patient is the voice of the caregiver. And are we advocating for them as well and including their perspective? So it's such an important piece, because usually that's the stage where you're deep into the healthcare services and you're deep into learning and communicating and medication refills and just all of those different pieces. So absolutely an important part of us.
Yeah, thank you for sharing the story. And every time I hear a health journey like that, I'm grateful that when a diagnosis isn't at a later stage, that. And I think the one other side of the diagram here, I'll point out because then I want to hear more of your thoughts about like where are our next steps as an industry? What's a step for us to focus on? Adam, I think this is the start of a lot of conversation that we need to have here. The one side I'll point out before asking you that is the preventive care and wellness side, which does include wearables. I would say it includes a lot of retail health offerings as well, where the incumbent health system centric, provider centric side of care can sometimes, again, just see that there's a wall in between them and say, like, that's not in our world. When somebody is sick, when somebody's ready, we are here to help them. And we have great ways to care for them, but those things are a little further out or not within just where we live and where we help the most. I would argue those worlds are converging more than ever before, and they do come into play because now there's just a lot more information, some good, some bad, some trustworthy, some not, and it's just making things more complicated. I do think there's a lot more, longtime listeners and subscribers and viewers know some of the things that Zane and I have test driven on this show, even of new devices and things and new ways to care for things. It's still like you can't just talk about that and not think about what does that impact on the clinical world. How does that impact other things? And then still, whenever I bring up a lot of healthcare things to my non-healthcare family, which is everyone except me, no one else is in healthcare in the family that I recall. Everyone's just like, okay, that sounds interesting, maybe. And I'm like, no, I think this is something that was really interesting to me. It might be really, really interesting to you. And they're like, okay, maybe. And that hesitancy is what I want to address as an industry. Is like the technologies are incredible. The advancements are incredible. AI is opening up things that will not be possible otherwise. And yet we're still going to leave patients and caregivers, to your point, and family members just saying, maybe, I don't know if I can trust that. I don't know if I believe it. There's a hesitancy they're going to have to overcome. And I do believe the tie into patient experience in my mind is you make things easier for people, then they trust that it's going to be better for them the next time.
Yeah.
The main reason in my mind, I'm convinced that people don't engage in their health or find ways to not go see a doctor or try any of these new cool things is that they don't trust it because they've had a poor experience in the past.
Absolutely. Right. They have battle scars because it's been so hard in the past. It's like, well, is this going to be any different? And I agree. I'm seeing progress as well. This is a complicated ball of twine you got to unpack, and it's a rat's nest of challenges. But what I like about this and that consumer-centric side of the diagram, it helps us continue to think proactively versus reactively. And so that's why it's such an important piece. And as far as other stakeholders that eventually could be added to this, this is an initial early effort. Definitely the influence of a healthcare IT vendor. They have significant influence in this journey. Definitely the health system, the payer, community programs, and they already touch so many of those things that we saw in the diagram. But it's, you use the word convergence, and I would agree that's very promising to see that there's effort there and progress. So I hope it keeps happening. And as we talk, I think that's our opportunity to push that forward.
I agree. Well, tell you what, let's plan on talking about this a lot more. Let's have you back on the show kind of in a regular cadence, because we are literally just starting a conversation here. And I think as we get more specific and talk about like what else we're seeing, this was meant to be kind of a foundation for us to build on. And we're going to drive this conversation if we have anything to say about it. So
Absolutely.
I appreciate it. I want to give you final thoughts or just anything else that we haven't talked about today, knowing that we're going to have you back on again soon.
Yeah, and I look forward to that, Jared. I love what you've done and how you are treating this as a movement now. And that's, sign me up. I'm very interested to support your efforts there. I guess I would just finally say that this is such a strange and unique time, and with lots of opportunity, though, because the information is available to make better healthcare choices. the information is there for patients. And next time we can talk about things I'm hearing on how patients are using AI and how it's impacting their decisions. You know, we use the word trust just as a brief mention. Patients are still skeptical about AI as far as how much they strongly trust it. However, because the access is right there, they can get information now, they tend to behave as if they trust it implicitly. They're canceling appointments because AI is saying, you might be just fine. And think about when patients start to trust it more and more. And so we'll unpack that in the future. And by the way, what is the clinician's response to that? How are they behaving, knowing that more and more patients are using these tools to get information about their own care? You know, it goes back to advocacy. It goes back to access. It goes back to preventative care. All those things on that diagram. So there's a lot we get to talk about together, and I'm really excited.
Fantastic. Thanks for joining me today. We're going to do this a lot more, like I kept saying, but let's keep moving in this direction and finding ways to drive that forward. Thanks, Adam, for everything you're doing in this way, for being a patient champion, for being that megaphone for patients, and I look forward to keeping this going.
Yeah, awesome. Me too. Thanks, Jared. Appreciate it.